Today we're going to talk about phonophoresis. Phonophoresis is the use of ultrasound to enhance the delivery of topical drugs. This allows application of the medicine safely and painlessly by transporting the drug into the underlying targeted tissue by a thermal or non-thermal means. Ultrasound in the form of phonophoresis increases the permeability of the stratum corneum in the skin, allowing the medication to diffuse across it due to the higher concentrations and gradient pressure under the transducer. Medication is administered locally rather than systemically. Indications for use. Phonophoresis is most often used with people who have conditions that involve pain and inflammation. Medications commonly used are anti-inflammatory medications such as dexamethasone, hydrocortisone, and cortisol, analgesics such as lidocaine, or non-steroidal anti-inflammatory drugs or NSAIDs such as diclofenac gel. Contraindications include pregnancy, over the reproductive organs, over the eyes, thrombophlebitis, plastic components, area of cardiac pacemaker, CNS tissue, over epiphyseal plates of children, malignancy or tumors, an area with active bleeding or infection.
Precautions include acute inflammation, fractures, breast implants, and patients with cognitive, language, or sensory limitations. Instructions on where and how to apply. Perform patient exam prior to intervention. Turn on and check the ultrasound equipment. Instruct the patient about the procedure and what is to be expected. Position drape accordingly while leaving treatment area uncovered. Identify the area to be treated. Select appropriate frequency range. Waves of 3 MHz are more appropriate for shallow targets, while waves of 1 MHz are appropriate for deeper targets. Apply medication and carrier to the skin as the coupling medium or under the coupling medium. When using conductive gel or glycerol contact coupling, apply thin later to clean skin. Too much will diminish transmission. Apply transducer faceplate directly to the coupling medium and maintain firm contact throughout the treatment. In all cases, keep the transducer moving when applying sound waves. Use circular movements in a rhythmic pattern at a comfortable rate of about 4 centimeters per second. Establish appropriate dosage based on the goal of intervention. Set intensity and quickly apply the transducer to the skin. At the end of treatment, turn off the power, clean and dry the patient, and clean the transducer. Perform all appropriate post-treatment evaluations. Intensity. Studies are limited, however, 1 to 1.5 waves per centimeter squared should be sufficient to produce enough heat. Duration, 5 to 10 minutes. Frequency. Frequency should be established with the treating physician to maintain the drug level properly. Suggested occupations. After phonophoresis, occupations such as cooking, light cleaning, laundry, self-care, typing, etc. can be performed. Joint protection, range of motion, stretching, and tendon gliding exercises should be performed as necessary. Documentation. Document the frequency, size of transducer, mode, duty cycle if applicable, intensity, duration, frequency of intervention, size and location of treatment area, and all patient responses.
So to start out, we're going to turn on the machine. We're going to select ultrasound. We're going to change the frequency to 3 and the duty cycle to 10%. We're going to keep the warming off. I'm going to set the time to 5 minutes. And we'll go down to 1 minute here. We already have the medication in the gel. We're going to start and then immediately apply the transducer to the skin. And just stay in the area that you want to work on, moving at a good rate. Then you want to wipe off the transducer and then clean the patient. And then you would move on to occupations.